Hello and welcome to MRCPsych on the Go Revision Essentials. My name is Dr. Alapasur and I'm a psychiatry trainee in the west of Scotland. Like many of you, I spent a lot of time commuting. This was valuable time that I could have spent revising for the MRCPsych examination. And so, I've started this podcast to help you revise on the go. Each episode breaks down one high-yield topic mapped to the syllabus. This is then followed by 5 questions to help reinforce your learning. So, grab your headphones, turn travel time into revision time, and let's get started. Let's start today with locus of control, a concept introduced by Julian Rotter, an American psychologist born in Brooklyn in 1916. Rotter trained in clinical psychology. He spent much of his career at Ohio State University. He was interested in how people's beliefs about the causes of outcomes in their lives influence their behaviour. In 1954, Rotter proposed his social learning theory. He emphasised that behaviour is shaped not only by reinforcement, but by the individual's expectancy about whether their actions will lead to desired outcomes. He called this concept locus of control. Individuals with an internal locus of control believe that their behaviour and personal qualities determine what happens to them. They perceive themselves as having meaningful influence over their circumstances. Individuals with an external locus of control attribute outcomes to external forces like luck or fate. They may feel that what happens to them is largely outside their personal influence. Remember, Rotter's locus of control describes the degree to which individuals believe outcomes are determined by their own actions, which is internal, or by external forces, which is external. Rotter developed the internal-external locus of control scale to measure this dimension. In fact, there is a fascinating bit of psychological trickery built right into this test. Rotter knew that people might try to trick the scale to look more independent and in control than they actually were. To stop them, he secretly hid filler questions throughout the test that had absolutely nothing to do with control. These questions acted as psychological camouflage, completely distracting the test takers so they would answer the real questions with total honesty. Research has consistently found that an internal locus of control is associated with better psychological well-being and more effective coping with stress. Patients with an external locus of control may feel that their health is determined by fate or by their doctors rather than by their own actions. This can reduce engagement. Interventions that build a sense of internal control may be particularly beneficial for these patients. These include motivational interviewing and self-management programs. We now turn to learned helplessness. This concept shares important conceptual ground with external locus of control, but has its own distinct theoretical history. Learned helplessness was discovered by Martin Seligman, an American psychologist who would later become known as the founder of positive psychology. In the mid-1960s, he was a graduate student at the University of Pennsylvania, working in a laboratory studying fear conditioning in dogs. In a now famous series of experiments conducted with Stephen Meyer in 1967, Seligman exposed dogs to electric shocks. To make sure it was the psychology and not the physical pain causing the stress, they used a brilliant setup called a yoked design. They paired the animals up so that both received the exact same amount of physical shock. The only difference was control. The first group could turn off the shock by pressing a panel with their nose, but the second group had no control at all. Their shock only stopped when the first dog did something about it. Later, both groups were placed into a shuttle box, a simple 2-compartment chamber, where an electric shock could be avoided by jumping over a low barrier. The dogs who previously had control figured it out instantly and leapt to safety, but the dogs from the uncontrollable group didn't even try. Instead of jumping the barrier, they lay down passively and whimpered. They completely surrendered, even though escape was possible. Seligman concluded that these animals had learned a devastating lesson, that their actions had zero effect on their reality. They had acquired an expectation of uncontrollability that crushed their motivation to try. He called this learned helplessness. Remember, learned helplessness is a state in which an organism comes to believe that outcomes are independent of its own actions. It arises following repeated exposure to uncontrollable aversive events. Seligman and his colleagues subsequently reformulated learned helplessness theory in humans. They proposed an attributional reformulation in 1978. They argued that when people experience uncontrollable negative events, they make attributions about why the event occurred. The reformulation identified 3 dimensions along which attributions vary. First, internal versus external. Did the outcome occur because of something about me or because of external circumstances? Second, stable versus unstable. Is the cause likely to persist over time or is it temporary? Third, global versus specific. Does the cause affect many areas of my life or just this one? A helplessness-inducing attributional style involves making internal, stable, and global attributions for negative events. In other words, it happened because of me. It will always be this way, and it affects everything. This attributional style is closely associated with depression. It maps directly onto Beck's cognitive triad of negative views of the self, world, and future. Remember, the attributional reformulation identifies internal, stable, and global attributions for negative events. A useful mnemonic is ISG, internal, stable, global. We turn now to the final concept in this episode, learned resourcefulness. This was proposed by Michael Rosenbaum in 1980 as a counterpart to learned helplessness. Rosenbaum was an Israeli psychologist. He argued that the emphasis on helplessness overlooked an equally important set of skills. These are the cognitive and behavioural skills that enable individuals to regulate their own responses to stress. Learned resourcefulness refers to a set of cognitive and behavioural skills. These allow individuals to regulate maladaptive thoughts, feelings, and impulses when facing stressors. Rosenbaum developed the self-control schedule to measure learned resourcefulness. He found that individuals with higher resourcefulness showed better adherence to medical treatment, more effective coping with pain and chronic illness, and greater psychological well-being. Learned resourcefulness is clinically relevant because it can be developed and strengthened through intervention. Skills. Training approaches in cognitive behaviour therapy, or CBT, directly target these skills. Remember, learned resourcefulness, proposed by Rosenbaum, refers to a set of self-regulatory skills that enable effective coping with stress. Now, let's test your recall. I will read out 5 exam-style questions. After each one, I will pause for 10 seconds so you can attempt them before hearing the answer. Question 1. A patient with type 2 diabetes consistently fails to adhere to dietary advice. He states that his diabetes is genetic and there is nothing he can do to change his health. Which construct best describes his orientation towards his condition? External locus of control. Question 2. A 45-year-old woman with recurrent depression has made multiple attempts to return to work over the past 3 years, and each attempt has ended in relapse. She now refuses to engage with rehabilitation, saying, "Nothing I do makes a difference." What concept can explain her presentation? Her presentation is consistent with learned helplessness. Question 3. A patient who has lost her job say, "It happened because I am useless, I will never be any different, and nothing ever works out for me in any area of life." Using the attributional reformulation of learned helplessness, classify each of these statements. I am useless is an internal attribution. I will never be any different is a stable attribution. Nothing ever works out for me is a global attribution. Question 4. How does learned resourcefulness differ conceptually from learned helplessness? Learned helplessness describes the passive, motivationally depleted state that results from exposure to uncontrollable events. Learned resourcefulness describes the repertoire of self-regulatory skills that allow individuals to manage stressors effectively. Finally, question 5. Name a clinical intervention that directly targets learned resourcefulness. Problem-solving therapy, CBT, and motivational interviewing. Let's summarise what we've learnt today. Rotter's locus of control describes beliefs about whether outcomes are determined internally by one's own actions or externally. An internal locus is associated with better coping and health outcomes. Seligman and Meyer's learned helplessness experiments demonstrated that exposure to uncontrollable aversive events produces generalized passivity and motivational deficits. The attributional reformulation identified internal, stable, and global attributions for negative events as the cognitive pattern most associated with helplessness and depression. Rosenbaum's learned resourcefulness describes a repertoire of self-regulatory skills that enable effective coping. These can be developed through therapeutic intervention. In our final episode in this series, we turn to resilience. We will explore what resilience actually means, the research that underpins it, and how resilience can be fostered in clinical practice. Thank you very much for listening to this episode of MRCPsych on the Go Revision Essentials. I hope this episode helped to move your revision forward. If you have any questions or just want to continue the discussion, you can find me on LinkedIn at MRCPsych on the Go, spelled MRCPysch on the Go. This podcast is about making revision accessible. If you found it useful, liking and sharing it with others helps the goal more than anything else. That's it for today. I'm Dr. Alapis Ehrlicher, and as always, keep revising on the go.